5-minute live stream. Let us continue the IVF series. So today we will be covering step 6, which is a female fertility workup. So we have two parts. One is investigation for the cause of infertility, and second is general investigations to ensure that patient is ready for pregnancy. So today we will not be covering male infertility because we will do so next week. We will focus on investigation of female infertility in preparing female patient for IVF treatment. So as we discussed in previous presentation, normal reproduction requires regulation of reproduction by pituitary gland using FSH and LH hormones, then production of eggs by ovaries, and delivery of the eggs to the tubes, and fertilization of egg with sperm in the tube, and implantation of the embryo in the uterus. So we need these 4 levels of requirements for normal reproduction, and we will be investigating for the cause of infertility accordingly, level by level. So first, we will investigate if there's any sign of pituitary dysfunction, which could be leading to infertility. Typically, the pituitary dysfunction may cause problem with the production of FSH and LH hormone. Hence, it can cause amenorrhea. So in the history, we'll check if there's any sign of irregular periods or absence of the periods. And also, pituitary dysfunction is caused by severe chronic stress. We will find out if patient has any stressful life events which may be causing infertility. And also, we will check the patient's weight, because being severely underweight or overweight may cause pituitary dysfunction. In terms of tests, we check FSH and LH levels and estradiol levels. Typically, patients with pituitary problem have a very low FSH and LH. And also, we check prolactin, because having high prolactin levels can cause infertility. So, and also thyroid function test, because thyroid function is linked to the pituitary problems. So next level, we check if ovaries are functioning well in terms of whether ovaries producing eggs or ovulation is taking place, or if there is a sign of diminished ovarian reserve. Typically, anovulation or ovulatory problem is caused by polycystic ovarian syndrome. In history, we will find out if there's any symptoms of PCOS, such as irregular periods, having excessive hair growth, and high body mass index. In terms of tests for that, we check for AMH levels and testosterone levels. For ovulation, we check progesterone, day 21 progesterone. And ultrasound scan, we will look for a sign of polycystic ovarian syndrome, and we check antral follicle count. AMH and AFC can be used as a diagnostic test for PCO. So next, we check the tubal, if there's any history which indicate patient may have a tubal blockage, such as chlamydia, endometriosis, ectopic pregnancy in the past, or pelvic surgery. And in terms of checking for the tubal patency, we use HICOSY or hysterosalpingogram, if necessary, laparoscopy and dye test. So next level is implantation. In terms of implantation, we take history of previous obstetric history and look for symptoms of diseases which may cause implantation problem, like endometriosis, pelvic infection, fibroids, polyps, or uterine abnormalities. So pelvic ultrasound scan is a right test to check if there's any there's any sign of fibroid, endometrial polyp, or severe endometriosis. If necessary, we can perform laparoscopy and hysteroscopy. So these are the basic investigations for to investigate the cause of infertility. If necessary, we will perform more in-depth investigation. So the next step is to ensure that patient is ready to get pregnant. So we have to review full medical history, previous obstetric history, surgical, history. If there are any medical problems, we need to address before starting fertility treatment. Then, as a minimum, we have to conduct these investigations to ensure the patient is ready for pregnancy, such as full blood count, iron levels, and insulin levels, to check for STIs and immunity for rubella and varicella and blood-borne viruses. So these are the basic investigations we perform before starting IVF treatment. Thanks for your time. This is end of my presentation. Have a great